Hi Mama, I'm Katie and today I'm 25 weeks pregnant. Welcome to this video where we are going to talk about baby development and then mama symptoms and how to alleviate some pregnancy symptoms where possible. Let's talk about our babies first. Our babies are now around 35 centimeters long and around 700 to 800 grams in weight. And if we were to compare it to a fruit or vegetable, they would be the size of a cauliflower. A rather small cauliflower, so this one might be a bit too big, but you can picture this cauliflower sitting inside here, and your uterus is around the size of a soccer ball. So they continue to grow, and so do we. Let's see, their skin is gaining more and more fat. It is still translucent though. When it comes to their hair growth, it is growing and they're getting tiny eyelashes and eyebrows, and they might start to be visible on an ultrasound. Their heartbeat is so strong that you can hear it through a normal stethoscope now, which means that if you have one at home or want to purchase one, you will be able to hear the heartbeat of your baby. So not only in the appointments with your gynecologist, but you could also have a listen now at home by yourself. There is a lot of brain development and rapid brain growth happening right now, especially in regards to the senses. So baby's sense of touch is developing. The baby can feel what they're touching, and they're touching the sides of the uterus. They're feeling the amniotic fluid, as well as even grabbing the umbilical cord. When it comes to hearing, they can hear and even distinguish certain sounds now. So if there is a loud, sudden sound, like a bang of some sort, for example, your baby might even react to it. Otherwise, baby hears what's going on inside our bodies, so the blood rushing through our veins, the digestive system, as well as your heartbeat. When it comes to the sight, the eyes are structurally developed. However, the eyes are most probably still shut. Baby will, in the next days or weeks, start opening them from time to time, but at the moment they are still shut. And then my favorite one, which is the taste, the sense of taste. Baby's taste buds are developed now, and baby is tasting the amniotic fluid. So whatever you eat, the baby is also tasting that. So if it is something bitter, they'll taste the bitter flavors in the amniotic fluid. If it's sweet, they'll taste the sweet flavors in the amniotic fluid. So this is just a bit of food for thought. Don't eat only sweet things. Have a varied and balanced diet so that your baby can already start experiencing all these different flavors in your belly, in the amniotic fluid that they are actively tasting, swallowing, and then peeing out. The lungs are developing rapidly as well, and air sacs are forming. However, baby will not take a real breath until they're actually outside in this world when they join us, but they are practicing breathing in and out, and by doing that also they're kind of taking in a little bit of amniotic fluid. And last but not least, you probably feel it, baby's getting stronger and stronger by the day, and they're kicking and moving and stretching, and could even get the hiccups. So a lot of movement is happening. This is super, super exciting. So that's more or less the updates when it comes to our baby cauliflowers. When it comes to mama, a normal gain of weight around this point in time is around 7 to 8 kilograms. If you're gaining a bit more weight, don't worry about it at all. If you're gaining a bit less weight, don't worry about it at all. Every person is different. Everybody's body reacts differently to pregnancy. Some people retain more liquids and more fluid, and therefore you can experience more swelling. Others experience less, so there are those kilograms. Otherwise, it's the baby itself, the placenta, the amniotic fluid, this lovely environment that's supporting baby, as well as the extra blood rushing through our veins, and that liquid retention. So what is happening now? You might be feeling again more fatigued than in the previous weeks, and this is because of baby's growth and development. And maybe that is causing you to not rest as well at night. To get better rest and better quality sleep, it's advised to use a pregnancy pillow. So that's a pillow that you will then put between your knees and legs. Also, you can support your belly from the side, so that then you are more aligned and can get better sleep. I made a separate video about pregnancy pillows, so I will put that into the description box below. Have a look at that and see how to properly use a pillow. You might be experiencing mild swelling in your fingers, in your wrists, as well as your ankles and your feet, and that is because of this liquid retention. This is something that I'm experiencing, so I can't wear my rings anymore, and my watch just fits, it's just about there. So let's see, 15 more weeks to go, more or less. So let's see how that progresses, or whether it stays the way it is at the moment. To help with the swelling and the liquid retention, the water retention in your body, you can wear compression socks. And this is something that I'm wearing today. They're very tricky to put on, but once they're on, they help with the blood circulation in your body. So that is definitely advised. You might be feeling hotter from time to time, and that is again because of all this extra blood flow as well as higher metabolism. You could be experiencing shortness of breath, and that is because the growing uterus is then pressing on the diaphragm, which is creating this shortness of breath. And again, because the uterus is growing, it's also pressing downwards, of course, and it's pressing on the bowels, so you might be constipated or have hemorrhoids. This could slow digestion as well, so what is advised is to stay hydrated, drink a lot of water, and eat a lot of rich in fiber foods. A few more things might be happening. You might have an increased vaginal discharge, but that is completely normal. It's protecting baby's environment from any potential infections. So if it is white and milky in consistency and doesn't have an odor, that's completely normal. If it gets or starts to be sticky or smelly or has a different color, so either it's colorless or goes more into the direction of yellowish and darker than that, please contact your doctor and have that checked. A few last things. You might be experiencing emotional swings, so that is due to the hormonal imbalance in your body, as well as potential stress or fatigue. We are getting heavier, this is getting harder again, so slowly going to finish the second trimester, go into the third one. So you might be feeling again more fatigued than in the previous weeks, and that might also be causing some emotional changes in you. So remember that these are normal, and just talk about it. Talk about it with your partner, with your doctor. Have a support system there for you that can help you if that is the case. And the last thing you might be experiencing from time to time is Braxton Hicks, which is these test contractions. So they should be painless. It's just your body contracting slightly, and that is to test before the actual labor arrives. So these were the updates for week 25. I hope you and your little cauliflower baby are feeling well and are doing great. What's important, remember to get that rest, talk about your feelings, exercise that also helps to regulate the emotions, as well as keeps your body fit and keeps it adapting accordingly to your changing body. And if you enjoyed this video, tell another pregnant mama friend about it. Tell her to join us in the Great Pregnancy Challenge, and I hope you have joined this challenge, meaning I release daily exercise videos with different workouts, with stretching, as well as strengthening workouts. And I've been doing that since week 8, and I'm intending to do it until baby comes. So, and this is to support my changing body, and I hope this is to encourage you as well to support your changing body and support your growing baby so that you feel great in pregnancy. Thank you for joining for this video, and I hope to see you soon. Take care.